Hello everyone and welcome to today's video. So in today's video we're going to be going into the last little video here in chapter 6, which is, continuing human genetics. And this one's a little bit different than the other ones. I have a little bit of word vomit in it, which I apologize for, but there's a lot of information here and I wanted to keep it all into one video, so I didn't want to have to write it all out. All right, so today we're going to be talking about genetic counseling and genetic testing. Human disorders and so forth. How do you work around that? So say you have a parent with Huntington's disease. So Huntington's disease is an autosomal dominant disorder. If you have a parent that has it, you have a 50% chance that you might have it. So you want to talk to someone, a genetic counselor, to see if, one, you can get tested to see if you are a carrier or not a carrier, but since it's dominant, if you have Huntington's disease, and then you can make a decision on whether or not you want to have children and that sort of stuff. Now that could vary from person to person, whether or not you want to know or you don't want to know if you're going to develop a neurological disorder. That leaves it up to the individual, and that's what genetic counselors are for. So genetic counseling is not only that, but providing info to patients, prospective parents. So if we're going to talk about these pre-birth and post-birth testing that you can do for babies and fetuses to determine if there's going to be any genetic disorders. And then, so prospective parents, you can be ready for it, or any other concerned individuals about the hereditary condition. So genetic counselors are certified healthcare professionals, scientists, and social healthcare workers. They also have to take certification boards. So these include the American Board of Medical Genetics and the American Board of Genetic Counseling. So they have pretty much, taking your boards, you're taking your exams. So the reason I'm saying this is that they go through a lot of training to get to the point to be a genetic counselor. They are, scientists and healthcare professionals. They take their boards. They do go through all the training a typical professional goes through. So now, what do? One, they assess risk and diagnose. So they can diagnose a disorder in an individual. They also then discuss options and resources, whether prospective parents, an individual who might be a carrier, or something like that. Then finally, of course, they provide counseling. So this includes both directed and non-directed. So non-directed counseling is where they don't guide the patient to decisions. So my example at the beginning of this talk was Huntington's disease. So they can tell the patient, look, you have Huntington's disease. You have a 50% chance of having a child with Huntington's disease. I'm not telling you whether you can or can't have a child. It's up to you now. Whereas directed is used when a standard treatment is available. So say unfortunately there's not a treatment for Huntington's disease, but if there is a treatment, they can then direct that patient to the proper treatment method. All right, so the rest of this lecture here, we're going into the genetic test. So prenatal and postnatal tests. So here, genetic testing, risks, costs, uses, and ethical concerns vary. So there's a whole bunch of tests available. Some tests are covered, some tests are required. Covered by health insurance, depending on where you are in the world. Some are all covered, some partially covered, and so forth. And we all know how messy that can get sometimes, but some are then also required. So we're going to talk about that a little bit. So first ones you can get are the prenatal tests, which are prior to birth. So it allows family to then make decisions about pregnancy and or prepare for birth of a child with a genetic condition. First one, this is one everyone gets done, the ultrasonography. That's the imaging of the fetus with sound waves. This is also a low risk. So some developmental defects in anatomy can be detected via that, but you can't detect most genetic abnormalities unless present itself physically during the fetal stages. Next one is called maternal blood screening. This detects hormone levels that may indicate certain conditions. Also low risk because it just takes the mother's blood. Now the next ones we start getting a little bit more risky. Amniocentesis. So it collects fetal cells from the amniotic fluid and tests those then for genetic conditions. So they have to then culture those cells, and then they do karyotyping and so forth to test different genetic disorders that could be seen in the karyotypes. Can be performed by the 15th to 18th week of pregnancy. Results are a few weeks later, and 1 in 400 procedures result in complications, and these ones are mainly miscarriages. I was going to include an image of amniocentesis, but I decided not to. It would take too much time. And then next one is CVS, or chorionic villus sampling. Again, also risky. This collects fetal cells from the placenta and then tests those for genetic conditions. It's a little bit faster because they don't have to culture the cells. They can directly do karyotypes on them. And this is about the 10th to 12th week of pregnancy. Again, it has those faster turnovers and slightly higher risk of complications than amniocentesis. And again, these aren't required. You can choose to get them done. So say you are a higher risk for having a baby with Down syndrome, you can do these tests to then make sure so you can be prepared for the birth. Next one is non-invasive prenatal genetic diagnosis. Collect and sort fetal cells from mom's blood and then test those for genetic conditions. That can be 10 weeks post-conception at the earliest. So non-invasive, so not as risky there. But again, the price then varies for all of these to get them done. And then pre-implantation genetic diagnosis, or PGD. This one isn't as common because it's screening in vitro or IVF embryos to remove any with known genetic defects from candidate pools. So it's looking at the embryos and seeing, oh, this one actually is a carrier or has the disorder. They don't use that one. They find one that doesn't have it. So if someone is a carrier of something like Huntington's, they can directly test for that, make sure it doesn't get it. So of course, that one might be a little bit more expensive. So it's after in vitro fertilization, but before implantation. So if parents are carriers of disorders, may be able to screen out affected embryos using that. So those are all the prenatal tests, and now the postnatal tests. So postnatal, performed in an individual who has been born. The first thing that happens is the newborn screening. So there's a blood test for infant to screen for common genetic diseases that are treatable. So example here, fetal ketonuria, or PKU. You want to, so that's where you are converting phenylalanine to tyrosine, or is it tyrosine to phenylalanine? One of those directions. That individual is lacking that enzyme to do that conversion. So this baby will need those supplements right away, and that individual will never express those phenotypes. So this is required for all newborns for certain conditions in all 50 states. Again, this is state-centric. I know these videos can be watched across the world. 29 conditions recommended by the ACMG because early ID can lead to effective treatments like PKU. Again, the treatment, you won't even know the phenotype is there. The individual will know they have it, but treatment can prevent showing a phenotype. And then here, presymptomatic screening. This tests to see if individuals likely to develop a genetic condition that manifests later in life, like Huntington's. Another example, so if a mother has high risk for breast cancer, has those BRCA, BRCA1 and 2 genes, so BRCA genes associated with breast and ovarian cancer, they can be tested early on to know and be aware of that. And also another example would be spinocerebellar ataxia. And there are a whole bunch of examples of those ones too. Heterozygote screening then, so it tests adults to identify carriers of recessive conditions. So parents can get tested then. So cystic fibrosis or sickle cell anemia are examples there. So if you're a carrier of sickle cell anemia, you present 50% of the phenotype actually, and you're less immune. You're less susceptible to malaria, interestingly. And then also, I also wanted to talk about these direct-to-consumer tests. There is a little bit more regulation coming into these, but they're not super regulated. By regulation, I mean FDA oversight. So they are commercially available. So we've 23andMe, Ancestry.com, all this stuff. You can buy a kit and send your spit swab back. These often lack appropriate info for the individual, so genetic counseling and things like that. So no counseling. Questionable accuracy because he doesn't have that full FDA oversight and regulation, and no guarantee of confidentiality. When I was prepping this lecture on stream, we had a great discussion of your data. So when you give your genetic info to someone, how could they sell that? How could they use it? Now we will talk about some things that the government has that protects you from that genetic information going out, but these direct-to-consumer tests, they have every means to sell it to private individuals. So say some marketing campaign, there's certain genes that increase addiction levels, and you're getting your genetic test done through like Ancestry.com, and they sell it to certain gambling, smoking websites, and then you all suddenly start getting hit with more ads related to that. So I'm not going to go into too many more details on that, but really think about this. And it's almost, because of that no guarantee of confidentiality, do you want to sell your genetic data, or do you want to allow them to sell your genetic data? It's really interesting to think about. It was a great discussion. And then, so if you want to have more discussions like that with me, come by the Twitch streams if you don't already. And then here, risk and limits of tests. So many prenatal tests have a risk of complication, so you just have to take that into effect. False negatives are also possible, so rare, unknown forms of cystic fibrosis. So there's tons and tons of different forms of cystic fibrosis, and the individual might have cystic fibrosis, they just don't have the means to test for that form yet. So it may not be found or detected. Some traits not easily predicted, so traits with incomplete penetrance, variable expressivity, or environmental influence are not as predictable, of course. And then, so for many disorders, there's no test as well. So if you forget what incomplete penetrance, variable expressivity are, those in a couple of the previous lectures. And then one thing I wanted to mention here with the no guarantee of confidentiality is this GINA Act in 2008, the Genetic Information Non-Discrimination Act. So this is a federal law. So again, states-oriented here. Only applies to health insurance and employment. So prohibits health insurers and employers from using genetic info to make decisions regarding coverage rates and or employment decisions. So that's very great. So imagine getting Ancestry.com and then your employer bought your genetic info from Ancestry and saw you were higher risk for breast cancer and maybe didn't want to hire you for that reason. There's an act that prevents that. So they can't also require genetic testing. Or imagine health insurance. They sold it to your health insurance provider and then they started charging you more because you're a higher risk for certain conditions. And so this does not apply to life insurance, though, disability coverage, or long-term care insurance. So the GINA Act only applies for health insurers and employers. So keep that in mind too, but it's a great act to help protect you. But yeah, that's all I have for today to conclude chapter 6 here. Next, we're going to be going into chapter 7, which will be going into genetic mapping and stuff. All right, if you have any questions on this or anything to add on that data stuff, feel free to let me know in the comments. And if not, I'll see you all next time. Hope you all have a great day, and bye-bye.